हेलो माय डियर फ्रेंड्स, कैसे हो आप सब। वेलकम टू माय यूट्यूब चैनल. Don't forget to like, share and subscribe and comment on this video, right? Starting from the topic that we have left, continuing with the topic that is derived positions. This is part 2, right? These are the derived positions from the position, fundamental position, kneeling, right? There are 4 derived positions from kneeling. The first one is half kneeling, the second one is kneel sitting, the third one is prone kneeling, and the fourth one is inclined prone kneeling. So let's see all the joint positions that are in this, right? The first position is half kneeling. In this we can see the upper body is straight, right? Now in the lower body we can see that the first leg, this is the first one, this is the second one. Okay, the first leg, the hip is flexed at 90 degrees, the knee is also flexed at 90 degrees, the ankle is in neutral position. The second leg, hip is extended, knee is flexed, and the ankle is plantar flexed. So now you can understand the muscles that are working basically, of course, right? The second position is kneel sitting. The upper body is straight, the lower body, hip is flexed, and we are sitting on the lower leg. Lower leg is back. Right, the knees has been flexed and the ankle is in plantar flexion. This is kneel sitting. The third one is prone kneeling. In prone kneeling, what we do is just like a child sits and crawls. This is the position, right? This is the person. This is the back, right? Hip. Now we can see the hip is flexed, the knee is also flexed, and ankle is in plantar flexion, right? And this is the shoulder that has been flexed, elbow is extended, and wrist is in a bit of extension, right? This is about prone kneeling. The fourth position, that is inclined prone kneeling. In this we can see that the back that has been inclined on the ground, right? We can see this is the inclined, right? And the shoulders are flexed and they are kept on head like this. Okay, and the hip that are extended, the knees that are flexed, and ankles that are in plantar flexion. So the muscles basically that are working, head and neck muscles, extensors are working to maintain this position. Spinal muscles are working to maintain this position, right? And hip flexors, knee flexors, that all muscles are working, right? Now in this position, basically this position is difficult for many people, but it can be easy if you perform exercises daily, right? So we can see in this that the trunk and head exercises can be performed. Like for in this, head exercises can be performed, trunk exercises, we can see the trunk exercises can be performed in this, right? And if we see for the pelvis anterior, posterior and lateral movement can be done on this pelvis. We can see, right, and anterior pelvic tilt, posterior pelvic tilt, that all can be done. So this is all about the 4 positions that are derived from kneeling. So now continuing with the positions that are derived from the sitting, fundamental position, right? Total there are 9 derived positions from this, right? The first 7 positions, that in this we can see that there is alteration in the trunk, right? And with the last 2 positions, the stoop sitting and the fallout sitting, they both are having alteration in the trunk as well as alteration in the legs, right? Now starting with the first position, that is stride sitting. This is stride sitting. Stride sitting is that means that having a distance, a good amount of distance between your legs, right? So we can see the upper body is straight, the shoulders are relaxed, the hip that are flexed, right? And the knee is extended, and the ankle that is in dorsiflexion. So the muscles working will be the dorsiflexors of the ankle, extensors of the knee, hip flexors. These muscles will be working in the position stride sitting. This is the position of stride sitting. Now moving to the second position, that is ride sitting. Like sitting when you are riding a bike, something like that. So this is the upper body that is straight, the hip that is, both the hips are flexed at 90 degrees, right? The knee is also flexed. We can see the ankles are in neutral position. This is about the right sitting. Now moving to the third position, that is crook sitting. Crook sitting is something like that forms like a mountain. So that is crook sitting. Upper body is straight, hip is flexed, knee is flexed, ankle is plantar flexed, right? Ankle is in plantar flexion. So this is about the crook sitting. The fourth position, that is long sitting. We can see the upper body is straight. That something that has been changed. That is the position of the legs. That is the hip is flexed, the knee is extended, and the ankle is in dorsiflexion. So this is about long sitting. The fifth position, that is cross sitting. Cross sitting is something we usually do every day, that we sit with crossing our both the legs, right? That's it. The hip is in flexion, knee is in flexion, ankle will be in neutral or it might be in plantar flexion according to your comfortableness. This is the fifth position. Moving to the sixth position, this is side sitting, right? In this, the upper body is straight, but the lower body, we can see the hip is in flexion, right? This hip has been in extension, and both the hips are in extension, the knees are in flexion, and the ankle is in plantar flexion. So this is about side sitting. The seventh is high sitting. That is nothing, you are just sitting like this on a high chair. Eighth is stoop sitting. Stoop sitting is like this, this is the chair, right? And you are sitting on it. The upper body, the trunk, that has been inclined forwards. The hip is in flexion, knee is in flexion, ankle is neutral. So this is about stoop sitting. And the ninth position, that is fall out sitting. This is your first leg, this is your second leg. The first leg, the hip is flexion, knee is in flexion, and ankle is in dorsiflexion, slight dorsiflexion. And if we see about the second leg, hip is in extension, knee is in extension, and the ankle is in plantar flexion. And the upper body, the trunk, that has been inclined forwards. This is about fall out sitting. Now you can basically understand the muscles that are working. Stride sitting, hip flexors are working, hip flexors, knee flexors are working, hip, knee, both flexors are working, right? Hip flexors, knee extensors, ankle plantar flexors are working. So you can understand this, right? And we can perform exercises like trunk exercises can be performed, strengthening, stretching exercises can be performed, right? Head and neck exercises, shoulder exercises, these exercises can be performed while sitting in this position. These positions are generally much more comfortable because of the increased base of support, right? We can see the base of support is more, base of support is more, base of support is more, right? So this is all about the positions that have been derived from the sitting positions. Okay, so now continuing with the positions that are derived from lying. Okay, so there are total 6 positions that have been derived from the lying position, right? The first position is crook lying. I said you crook means something that makes up like a mountain. So nothing, we are lying and the hip that has been flexed, the knee that has been flexed, and ankles that are slightly in plantar flexion. We generally do this while we sleep or something like that, right? So this is the first position, the joint position. The muscle working will be the hip flexors, knee extensors, ankle plantar flexors. All the muscles will be working. And the second position is crook lying with pelvis lifted. This is like, this is same, just like this. The difference is the pelvis is lifted in this and the pelvis is stable in this. That's the difference. So we can see the pelvis has been lifted. The knee is in flexion, the ankle is in neutral or slightly dorsiflex. So this is crook lying with pelvis lifted. The third position, that is half lying. We do this position, right, many a times. In this, the upper body is stable. We are lying on the bed or something, and the hip that are flexed, knee that are extended, and ankle that are in dorsiflexion. So this is half lying position. Fourth is prone lying. We are lying with the forearm support. We are lying in a prone position, facing downwards, and hip hip are in extension, knee are in extension, ankles are in plantar flexion, upper body is straight, and the shoulders that are flexed because of the forearm support that we are using in this lying position. So this is prone lying position. The fifth position is leg prone lying. We are out of the table, the upper body is out of the table and the legs that are supported on the table and tied up. So this is the leg prone lying. Of course, this is uncomfortable positions for many of the individuals. Moving to the sixth position. Sixth position is side lying. We perform this position, we try to be in this position many of the times when we are sleeping, right? So this is the bed or couch or something. So we are in side lying positions. The hip are in neutral position, knee are in extension, and ankles are in neutral position. Shoulders are neutral, elbow is extended, wrist is in neutral position. Just the component that we have to see is we are in a side lying position. The seventh is sit lying. Sit lying is the knees that are not on the couch. We can see the knees are hanging and ankle is also hanging. Ankle will be in plantar flexion, knee is in flexion, we can see, and the hip will be in neutral or kind of bit of extension. Upper body is straight. So these are the 7 positions that are derived from lying. Now you can basically understand which muscles are working. Hip flexors, knee flexors, hip extensors, plantar flexors, dorsiflexors are working, right? Prone lying mein here it is plantar flexors are working for ankle, knee extensors are working, pelvis is lifted. So the rotators of the hip will be also be working and contributing to maintain this position. So this is all about the muscle work. And what are the effects and uses? Stability is more, the base of support is more, so these positions are comfortable. Okay, not this position, but generally these positions are comfortable. We use these positions while we are sleeping, and we can perform many exercises like ankle pumps can be performed. If we are having a back pain, we can perform single knee to chest, double knee to chest. Those all exercises can be performed in these positions, right? Okay, so now this is the last position. We are going to end the topic very soon. This is the positions that have been derived from the fundamental position hanging. There are 4 positions that are derived from the hanging position. The first one is fall hanging, second one is crouch sitting, the third one is prone falling, the fourth one is side falling, right? This is the fourth one. This is side falling. Now, if we see in the diagram, what we can see, this is the fall hanging. The elbow is extended, the wrist is in flexion, and we are trying to hold something and we are in a fall position. So this is fall hanging. The shoulders are flexed, the elbows are extended, and the wrist that has been flexed, right? Fingers are flexed. So shoulder flexors, elbow extensors. Continuing with the second position, that is crouch sitting. We are in a sitting position. We can see the spine, the upper back that has been inclined forwards. The hip is in flexion, the knee is in flexion, the ankle is in dorsiflexion. This is crouch sitting. The third one is prone falling. In this prone falling, we can see this is just like performing a push-ups, right? The hip is in extension, the knee is in extension, the ankle is in dorsiflexion, the shoulders that are in neutral or extension position, elbow is in extension, and the wrist is also in extension position. This is prone falling position. The side falling position. In this way, we have got a support from the wrist, and we are in a side position. The hip that are neutral, the knees are in extension, the ankles are neutral or slight dorsiflexion. The shoulders that are neutral, the ankle, the elbow that is in extension, the wrist that is neutral or extension. So these are the joint positions of these 4 positions and the muscles that will be working. Okay, so if here elbow is in extension, elbow extensors will be working, wrist flexors will be working, prone falling, elbow extensors, wrist extensors, hip extensors, knee extensors, ankle dorsiflexors, this all muscles will be working. Head and neck prevertebral muscles will be working to maintain the positions of the head, right? And in this position, the extensors of the knee, the dorsiflexors of the ankle, this all the muscles will be working. Wrist, both the muscles can work to keep the wrist in the neutral position. So this is all about the muscles that are working. These positions are comparatively much difficult to perform by a normal person, normal individual. This is easy to be performed by an gymnastic or athlete or the person going to the gym training. They all can perform this positions, and the base of support is sometimes decreased because we are just having the support of this, so it can be a difficult position to be performed. So these are the fixed and uses. So these are the 4 positions that have been derived from hanging positions. So here we complete our topic, the derived positions, and thank you for watching this video. Please like, share, subscribe and comment. I'm always there.